Hi there, I'm Dr. Johnson, your anesthesiologist. Thank you so much for entrusting us with the care of your little one. We know it's not an easy decision to have sedation and general anesthesia in the office, but let me assure you, you have chosen wisely. Our team practices to the highest level of safety and skill, ensuring that your child is comfortable and is able to have all their dental work performed safely and comfortably, often avoiding multiple traumatic visits to the office. In this video, we demonstrate our process so to make you familiar with what happens the day before, the day of, and several days after your appointment. Please pay special attention to what happens in this video as it ensures a smooth process for all of us. Once again, thank you so much for choosing us, and I look forward to seeing you soon.
First, it is important to note that this appointment is not a regular dental appointment. Please be available all day as we may call you to come in earlier or later if we're running ahead or behind schedule. While we understand things can happen unexpectedly, please communicate with us ahead of time if your child is sick or unavailable for any reason so we can make adjustments or reschedule. Please provide us with a working number as one of our staff members will call you. Arrive 15 minutes before your appointment to fill out any last-minute paperwork. Before coming to the surgery room, we will record your child's weight and height. Have your child in loose-fitting clothing. Pajamas are acceptable, but please avoid having them wear onesies. If your child has long hair, please tie it up in a bun at the top. If your child is taking any medication, please follow the anesthesiologist's instructions when he or she calls or sends you a message the day before. The day before your child's appointment, it is vital that they don't drink or eat for at least 8 hours before the appointment time. This includes water. Failure to do so will result in your case being canceled, as it is very dangerous for your child if this particular directive is not followed. Once vitals have been checked, place your child on the chair and remove their shoes and socks and jacket if they're wearing one. Next, we will connect the monitors that measure the oxygen, heart rate, blood pressure, and heart rhythm while your child is asleep. Sometimes your child may not allow us to put them before we put them to sleep. In case, we will place them on after they fall asleep initially. A mask is placed to cover your child's mouth and nose, and they will breathe in normally the sleepy gas to fall asleep. This process takes about 60 to 90 seconds. Some movement of hands and feet are normal during the process, but there's no harm to the child. The IV and the breathing tube are placed while the child is asleep. The dentist will then perform the dental procedure. The average time is about 2 hours but can change depending on the amount of work that is needed. Once the procedure is done, your child then is taken to our recovery room for 15 to 20 minutes accompanied by you and an assistant until they wake up. You and your child are then dismissed after the anesthesiologist or assistant gives you the discharge instructions. No outings such as swimming, sports, or school are recommended for the remainder of the day. Nausea and vomiting are normal and will go away. Please follow the instructions given when being discharged. Your child may sleep for a couple more hours, which is normal. If there are any concerns, please text or call your anesthesiologist at the number provided. Thank you for allowing us to take care of your child.